Hello, and welcome to Coping with COVID, the first session in our series, Your Mental Health. I'm Louise Campbell, Vice President of Lionsgate Hospital Foundation, the fundraising arm of the hospital and all publicly funded healthcare facilities and services across the North Shore. In the new year, the foundation will launch a fundraising campaign to improve emergency care for people dealing with acute mental health issues. While we were talking to psychiatrists, social workers, and mental health nurses about the campaign, we kept hearing about the growing number of people in our community who are dealing with mental health struggles as a result of the COVID pandemic. With the continuing increase in social isolation, LGH Foundation has created this webinar series to share the knowledge and expertise of our mental health professionals based at the Hope Center. I'd like to share with you a recent chat I had with Linda Latham, the manager of the older adult mental health team on the North Shore. I hope you find it informative. Hi, Linda. Thank you for joining us today. We've removed our masks. We're sitting at a safe physical distance, and we're sitting in the beautiful Hope Center for Mental Health, which actually doesn't feel like a mental health facility at all.
We're so lucky to have this facility. It's been open now since 2015, and I think all of us every day come to work and we say, what a wonderful place to come to work. And it's been so good for our clients to have all the natural light.
Tell us about the work that you and your older adult mental health team do here at the Hope Center and in the community.
Well, the older adult mental health team is a specialist consulting team comprised of an interprofessional team. We have 4 psychogeriatric psychiatrists, and we offer services both in the community and to our long-term care facilities on the North Shore. Basically, the team does psychiatric assessments and plans treatment for our older age population. And basically the group that we're really interested in working with is, or that our mandate is for, is the older adults who have mental illness and are showing some cognitive decline. Now, mental illness can onset, as you know, fairly early in life, and so people carry on with their mental illnesses into their old age. It can also happen in old age. We also do a lot of education. My team is always out in the community talking to places like home health, because they come in to help our clients and sometimes aren't quite sure how to manage. And we also interact a lot with the teams here and the beautiful Hope Center, because our patients do get admitted to the 4th floor, which is where our inpatient unit is.
Today we're talking about dealing with loneliness and depression during the pandemic, and it's a topic that is particularly important as our social distancing measures are more restrictive. Linda, I think there's a general understanding about loneliness, but talk to us about depression. What is it, and how does it feel?
Yeah, most people think that depression is largely a mental manifestation, but actually, if there's ever a mind-body connection, it's with depression, because usually what happens is people don't eat, or they eat too much. They don't sleep, or they sleep too much. They feel very, very low energy. They have no joy in their lives. Things that used to be pleasurable for them stop being pleasurable. They have bad memories. They're very forgetful. They may be quite irritable sometimes too. So it's like the whole way of being is disrupted with depression. There's still some stigma attached to it, and there's also, I think, people just don't have an awareness of what a mental health illness like depression feels like. Both of them are caused by an imbalance of chemicals in our brain. We have things called neuroreceptors in our brains that produce what we call the happy hormones. And when people are under stress, oftentimes other chemicals in our bodies decrease the amount of our feel-good hormones, and then we feel depressed. We have many treatments that we can work with people to get those feel-good hormones back again, but we can't treat you if you don't come.
If someone does end up spiraling and experiencing the symptoms that you mentioned before, where do they go for help?
Well, the first and most important thing is come. We can help, okay? And secondly, I think it's, like we have teams that will try to understand what is the thing in your life that you miss the most, okay? What is your goal? Why did you come? What would you like to see different? And so we'll work with you to set some goals around how you can start to feel better. And we do have a really good tool chest of treatments that we can use. Most people think that it's all around medication, but there are two other things that we use in conjunction, or sometimes only use if it's mild to moderate depression, and that's exercise and cognitive behavioral therapy. And we'll have to use some trial and error. It's going to take us a little time to figure out what works for you. But if you stick with the program, most people start to feel well. It doesn't happen overnight. The first things we notice oftentimes is that people start to sleep better, which is a really important thing. Then their appetites sort of normalize out. And so it's really a journey, okay? What I usually say to people is, and this is again from my experience, you didn't get depressed overnight, okay? It was a downward trajectory. And so we're going to have to take time to get you back to where you were, and so that you feel like yourself. And often people talk about depression as they don't feel like themselves. They're not me, okay? But they don't know what's the matter. And that's what it feels like. Well, in my experience, general practitioners are usually very skilled at dealing with anxiety and depression. And we often will not, if we saw everybody who was anxious and depressed, our services would be overrun. It is being managed very, very well in primary care for the most part. So I think general practitioners are really good at helping initially with things like anxiety and depression. I've had really good experiences working, in mental health, where the GPs, if they run into difficulty, that's when they will make a referral to one of our specialist teams.
You mentioned cognitive behavioral therapy, and we're hearing more and more about that. How does it work?
So one of the things, this is an area that has received a lot of research, and we know that there is a connection between how you think, how you feel, and how you then behave. So cognitive behavioral therapy is a therapy that looks at, the connections, like how are you thinking that may be pulling your spirits down. And typically what happens is that oftentimes people become very down on themselves. Depression has, in past, people would say, well, just pull up your socks, have a stiff upper lip, that kind of thing. And they feel ashamed and embarrassed that they are not functioning the way that they should. And then they begin to start saying, I'm really useless, I'm disappointing my family. And that is where we intervene with cognitive behavioral therapy to try and change the way you think. And it's a very powerful tool. Again, Changing negative thinking, one of the ways I often explain it to people is that I say, your brain is like Teflon for positive feelings and like Velcro for negative feelings, okay? So we've got to smooth out the Velcro and get rid of some of your negative thinking. And it's going to take time and practice, but the more you do it, the more you will be able to interrupt that sense of I'm worthless, I'm useless, and start challenging those thoughts. And that's exactly what the treatment is all about. There's many techniques that we use, but oftentimes we will challenge you, say, is it the truth that you're really useless? What have you done today? You know, and oftentimes when we start challenging thinking, people can then reframe how they think.
So are you saying it's all about thinking that our glass is half full?
Yes, it's reframing your thinking, and we know that reframing your thinking will change the way you respond to your environment.
Some of us don't have a family doctor or GP. What do we do then? Do we go to a walk-in clinic for help?
And we have good resources here on the North Shore. We have our urgent and primary care clinic that just opened last year down on the Esplanade. We have Health Connections, which is on St. George and 15th, again for people that do not have GPs. And in a worst case scenario, if what you usually do is to go to a walk-in clinic, then go to the walk-in clinic and be directive and say, I've felt down for a long time, I need to be referred to a mental health team.
If we see a friend or family member struggling with loneliness or depression, what can we do to help them?
A lot of people, just as a lot of people don't know how to get help for depression, a lot of people don't know how to help others. For me, I always come from a place of compassion and try and sort of get into their shoes and think about what it must feel like, and to try and verbalize that, to sort of say, Louise, you seem to be really struggling right now. You know, you've gone from being, a joyful, outgoing person to somebody who won't leave your home. Is there anything I can do? We've been good friends for years, okay? Or if it's a family member, it's really bothering us to see you being so uncomfortable. And people may not want to talk right away. So it's really important that you let them know that you will be there for them, and then just regularly checking in. Sometimes identifying some resources can be helpful as well. But the big thing is to legitimize the fact that you can see that there is something not right going on for them, and encouraging them through your support or through them seeking some other help, encouraging them to get the help.
Let's talk about Christmas, something that's on everybody's mind. This year, we're all feeling more stress, more anxiety, a general level of uncertainty. What can we do to limit our stress and avoid any kind of isolation, depression over the holidays?
Well, I think one of the things is again, it's that awareness piece. We should all expect that we are going to be under more stress at Christmas. We're under more stress right now, and I don't think it's going away by Christmas. So we really need to, first of all, just put it out there. This is quite stressful, living in the times of COVID. And I think it's really, really important that we plan now for our Christmas. If we try to follow all of the COVID rules and still have Christmas as usual, I think, one, we will be super spreaders if we're all getting around the table with relatives that come from afar. And two, I think it would be, make us more worried perhaps about our own health.
And so what sort of plans do you have for your family this Christmas?
We found a spot in the woods, and we are going to do something totally different this year. And we're having a barbecue, and it's turkey burgers, not turkey this year, that we're having. So, and it will be probably s'mores and not minced tarts and pumpkin pie. So a completely different take on what Christmas is all about. We'll remain outside. We won't be together too long because of the age group of the kids, and we've involved them, so they're really looking forward to it.
Recognizing we're all under stress, talk to us about some ways we as individuals can cope with COVID.
Well, again, I think one of the first things that I say to people, and it's not the first thing that comes to everybody's mind, is that, in order to cope, I think we have to be healthy ourselves. And so I think self-care is really, really important. And a lot of people still have the sense that self-care is selfish. I always think about the analogy, if you're in an emergency situation on an airplane, the crew tell you, put on your mask first before you help your children, right? And I think it's the same thing during COVID. We have to put on our health mask before we can be sure that we can support our families and the other people that depend on us. And there's absolutely nothing selfish about it.
Are there always negative consequences to situations like this pandemic?
Well, I think it's one of these situations. It's like anything. There is opportunity for change and growth. And I think, the pandemic is something that can help us think about things differently. In my experience in mental health, while people wouldn't have chosen to have a mental illness, they often come out of it better than they went into it because they have more awareness of their own strengths. They have more awareness of the importance of self-care and an awareness of how important it is for us all to keep engaged with our families and our friends and our community. So I think, I'm hoping coming out of COVID that if we can stay positive, there will be some growth and change that we're all proud of.
And finally, Linda, if you were to give us 3 takeaways to improve our mental health during COVID, what would they be?
I think I would say, first of all, remember this isn't forever, okay? Secondly, look after yourself so that you can look after others. And I think the other thing is to don't try to do things the way you've always done them. Be open to new ideas.
Thanks so much, Linda, for your time, your insight, and your thoughts on how to thrive, not just survive, living with COVID.
It was great talking to you.
We have a collection of online resources and a contact number if you would like to talk, which will appear at the end of this webinar. We'll also include this information in a follow-up email to all of you watching today. Now, we'd like to share a few words from members of Linda's team, our mental health point-of-care staff. We're so grateful for all the work they've been doing over the past 8 months. We thought you might like to hear how these experts are personally handling the stress of COVID-19.
Hi, my name is Zoe Cricken, and I'm the patient care coordinator for the Carlisle Youth Concurrent Disorders Unit and the ED psych nurses here at Lionsgate Hospital. For me, what I found works to help me deal with the stress and the anxiety and just sort of the unpredictability of this, of the COVID situation is to really make sure that I'm taking time for myself. And that could be even simply just taking a breath, The other thing I find that works really well is making sure to connect with things that I like. So making sure that I have a playlist in my car on the way home from work that has my favorite song that I can sing at the top of my lungs and not care who might be watching me as I'm driving across the bridge. The other thing is to check in with my colleagues. I find that, it's really easy to get caught up in the idea that this is something that you're experiencing just by yourself. And so having that connection and checking in with your colleagues and the folks who are around you each day to know that it is a shared experience and that we all are being impacted in some small way. And so doing things that you like and reminding yourself of time for yourself, I think those are the two biggest ways that I've been helping myself to deal with the COVID situation.
My name's Liz. I'm a registered psychiatric nurse and I work out of the Hope Center. I'm a case manager with the housing team and I work within the group homes, so mostly community-based. Okay, so I think my number one tip for managing and coping through COVID would definitely be meditation. I have made myself a little corner in my room where I have a plant, my salt lamp, some essential oils, a meditation cushion, and that's my go-to place every night before I go to bed. So I make room for at least 10 to 20 minutes of sitting and just letting the day kind of fall away, and it really honestly helps me sleep, and I feel a huge difference since I've been meditating. My second tip for managing through COVID has been yoga. I have got a really great app on my TV, so I can pull up any kind of yoga class. After work, I come home at 4:30, roll out my mat in my living room, and have been doing yoga. It's kind of nice doing it on your own because I say it's a little bit more silent and you can really focus on getting out of your head and into your body. So yeah, that would be my number 2 tip. My third tip for coping with COVID has been to become a plant mom. So I, in the beginning of COVID, bought a lot of plants, and it's kind of nice because it's like bringing the outside in, and it's something that I can care for every day. And honestly, I've been like talking to my plants and I tell them my problems and worries, so they've become my little green therapist within the house. And yeah, it's just a nice little hobby to have, and it keeps me busy and keeps my mind focused on something else.
Okay. My name's Gail Harrison, and I'm a clinical nurse educator here at Hope Center for Mental Health and Substance Use in Coastal. And in terms of how I've been coping with COVID, it's really being aware of where I'm feeling losses and what I can do about it. So instead of focusing on the loss of what I cannot do, I'm looking at what's going to help me in that moment in time. So I knew coming into winter that I'd have to be really on it in terms of coping with the winter, dreary, kind of rainy months. And so I realized I could do a few things to make it a little bit better for myself. One is actually this clear umbrella. So I wanted to be more mindful in my in the environment that I'm in. So be able to still take in the trees and leaves and the glorious little painted rocks and enjoy those things to stay present. Okay. So social connections, those friends, really important. And my group is really, really small, and I have to also be understanding that there's limitations to what we can do. So one of my dear friends, we decided we would watch movies together and do things like bake Christmas cookies, but we can't do that this time of year. We can't do it right now. So I figured we still need to do that, and we're going to use Zoom or FaceTime and still do those activities and just have that FaceTime or Zoom to allow us to have that communication that we'd normally do if we were actually in the same room, but do those activities that we find fun.
Thank you so much for joining us today. I hope you found our first session in the series useful. We're hosting our next session on the issue of stigma surrounding mental health in January, and we'll send you more details about it in the new year. I wish you all the best for a happy and healthy holiday season. Merry Christmas from all of us at Lionsgate Hospital Foundation.